Good morning, everyone. This is Cameron Smith in Secretary of State's office. Welcome and thank you for joining this morning's public hearing. I want to open a public hearing today on fiscal impact statements and explanatory statements for Legislative Referral 401, Referral 402, IP 34, IP 44, and IP 57. A reminder that this meeting is being recorded and that interested parties may also submit written comments by email to elections.sos@oregon.gov. Let's go ahead and see who we have on the call. When called upon, if you could take yourself off mute, state your name, any affiliation, if any, and which initiative you would wish to testify on today. Let's go ahead and start with Natalie Offenbecker.
Hi, Natalie Offenbecker. I am just listening. I don't have any comments for today, so just wanted to listen.
Great, thank you. Chris. Chris, if you could take yourself off mute and introduce yourself and which initiative you'd like to testify on today. Let's go ahead to Andrew Cohen with DAS.
Hello, this is Andrew Kahn, and I'm with the Department of Administrative Services. I'm a budget and management analyst, and I'm not here to speak to any particular petition. I'm just here to listen to other comments.
Great, thank you. Bobby McAllister.
Good morning. I'm a concerned citizen, and I have no comment or testimony today.
Great. Steve Berman.
Good morning. This is Steve Berman. I am working with a number of campaigns on various initiative petitions and measures. However, I am just observing, hopefully, today, and do not plan to say anything.
Great, thank you. Jessica Adamson.
Good morning, Jessica Adamson with Providence Health and Services, and I have some comments on Referral 402.
Great, thank you. Janice.
My name is Janice Watson. I'm an attorney in Medford, Oregon. Just observing, no comments on any of it.
Great, thank you, Janice. Alicia Givens. Alicia, if you could take yourself off mute and introduce yourself and which measure you might want to testify on. You there, Alicia? Let's go to Antonio Gisbert.
Good morning, Antonio Gisbert calling in from Corvallis. I'm just listening and learning today. Thank you.
Great, thanks, Antonio. Katie Thiessen with ONA.
Yeah, hello, good morning. Katie Dyson with the Oregon Nurses Association. Just brief comments on Referral 402.
Great, thank you. Meredith Koba with Treasurer.
Hey, good morning, Cameron. I'm just listening in this morning.
Great. Elizabeth Shepard.
Good morning. I'm just here to observe comments on Referral 402.
Great. And then some callers. Let's see, if you're on by phone, if you could go one by one and introduce yourself. Jump in.
So this is good morning. This is Andrew Dyke. I'm from an economic consulting firm, and I'm here to provide testimony on IP 44.
Great, thanks, Andrew. Any other callers that want to identify themselves?
This is Anthony Johnson. I'm the chief petitioner for IP 44, but I'll just be listening and not making any public comment.
Thanks, Anthony. Anyone who hasn't introduced themselves? All right, so looks like we do not have anyone testifying on the legislative referral for 401. Let's go ahead and start off with testimony for legislative referral 402, and let's start with Jessica Adamson.
Thank you so much. Again, Jessica Adamson on behalf of Providence Health and Services. And I am going to pre-associate myself with my comments from my colleague, Katie Thiessen, who is also working on this issue, but wanted to touch specifically on the issue of federal match. As you well know, IRR 402 relates to the Medicaid program and the tobacco tax to fund it. 90% of those dollars will go into the Oregon Health Plan. That program includes a lot of federal match. Under federal law, those dollars will be greatly increased by the federal government through the FMAP or federal match process. For every dollar that comes from IRR 402 for OHP, the federal government will pay $2.66 for the remainder of the 1921 biennium and $2.72 for 21-23, according to the Oregon Health Authority, and again, based upon the current federal match process. We believe strongly that the state will benefit from these dollars and that the voters deserve to know the impact of the federal match on these programs, as the initiative petition requires these dollars to go into the Oregon Health Plan. They will be subject to match. We believe that the amount of match should be calculated and should be included as part of the financial estimate of this measure, because it is significant and a substantial part of the benefit of this measure. So those are all the comments that I have, but again, strongly encourage the Financial Estimate Committee to include that information as part of the statement to the voters. Thank you.
Excellent. Thank you, Jessica, and thank you for your written comments that you submitted as well. Let's stay on 402 and go to Katie Thiessen with ONA.
Yeah, thank you. So again, for the record, Katie Dyson with ONA. Really just thanks for letting us provide public comment, and thanks to the good work of the committee to make sure that the fiscal impact statement and the explanatory statements on all of the measures really help voters understand and make good informed decisions in November. So as you said, Jessica and I did submit a comment for the record, but did want to just verbalize and highlight a couple of points in the current draft of the statement and some suggestions that we'd like to see to really just paint a more complete picture for voters on the fiscal impact, the net increased revenue, and the cost savings from this measure. So the first thing that I just wanted to quickly point out, I think, at the last meeting, Treasurer Reed had a really good question or comment on the distinction between a marginal increase versus an increase on the whole. And I think what that really just spoke to is that there needs to be greater clarity in general in the draft on the overall cigarette tax structure and the increased revenue. So like being very clear and in as plain language as possible for voters that legislative referral 402 creates a new $2 tax. The measure doesn't touch the $1.33 tax that's currently there. And it doesn't change those allocations from the current cigarette tax either. Secondly, this is a revenue raising measure. And so I think there needs to be more clarity and emphasis on just how much revenue this measure is projected to raise, and that the new revenues can explicitly only be used by the Oregon Health Authority for the Oregon Health Plan and prevention and cessation programs as defined in the statute that was passed. This is a really long impact statement, and I think that's great and fine, but I do think, making sure the projected increased revenue to the state at $111 million and then at $331 million for a full biennium, which is a really essential question that voters will have, isn't buried in a sea of text and sentences and narratives. And then, thirdly, I think that the current draft really doesn't make any mention of the significant costs incurred to the Oregon Health Plan currently, about $374 million a year just from tobacco-related illnesses. So if we're looking at the full revenue picture with people smoking less, that's going to have an overall net cost savings for the state. And kind of in that same vein, I think in the draft and at the last meeting, folks were talking about behavior change. But, for voters, that's not very clear. And so we'd like that to be clearly defined as either, a reduction in smoking or a reduction in cigarette, vape, and cigar sales. And we just ask that, you know, for the lowest information, the lowest education voter, that the terms are really, really clear. And then finally, just a little bit on formatting here. You know, this is a long statement, as we've said. There's just that one graph that talks about or table, I should say, that only talks about the speculative losses with reduced smoking rates. And, you know, the rest of the revenue descriptions are all narrative. I think we all know just inherently, naturally, that voters will be drawn to that graph. And so I think, you know, just in terms of presentation, we'd ask for consistency and intentionality on how information is presented to voters. So as I said, we've submitted the full comments for the record, but again, really appreciate your all's time, the committee's time in making sure that this is super understandable for voters.
Great, thank you so much, Katie. Anyone that we've missed that would like to offer testimony or comments on Legislative Referral 402? Excellent. Anyone that we've missed that would like to offer testimony or public comment on Initiative Petition 34 around psilocybin? Great, let's jump to Initiative Petition 44 on treatment and on different possession penalties. And I believe we have Andrew, I believe it was Dyke, but Andrew on IP 44, please.
Yes, correct. Thank you. Yeah, so you know, this ballot measure passed to decriminalize possession of certain drugs and fund drug addiction treatment through reallocating marijuana tax revenue. My comments refer to the first component of that, the decriminalization of possession. In late 2019, my team at Echo Northwest calculated and reported on the potential cost savings that may be attributable to this decriminalization. And we believe that the best informed voters, the fiscal note for IP 44 should reflect this potential cost savings. Our calculations were based on the available research literature from organizations such as the Washington State Institute for Public Policy, the RAND Corporation, and others, and on criminal justice data for Oregon. We included estimates for potential cost savings by the police, the court system, community corrections, and state prison. And as described in a little more detail in my submitted written testimony, we have recently updated our initial calculations using some more recent conviction counts from the Criminal Justice Commission. Feeding into these updated calculations, we estimate about 8,000 arrests would be avoided annually if voters pass IP 44. The CJC data suggests that about 1,900 misdemeanor convictions and about 1,800 felony convictions per year would also be avoided, with subsequent reductions in expenditures by the courts, state prison, and so on. Based on these updated data, our new calculations suggest potential cost savings of between 32 million and 49 million per year, which, after accounting for rounding, translates into between a range of 63 million and 97 million per biennium. We find these to be fairly substantial. Now, the state may not realize this level of savings immediately because individuals arrested for possession offenses move through the criminal justice system at different rates. Some costs, such as those for community corrections and prison, are spread over multiple years, potentially. However, the police and the court systems would be more savings by the police and the court systems would be more fully realized even in the first year of implementation. Again, based on the same data, our calculations suggest that potential savings by the police and the courts of between 13 million and 22 million per year, or between 25 million and 44 million per biennium after accounting for rounding. With cost savings increasing each year into the future as the systems fully adjust to the revised statute. So in conclusion, we find that IP 44 could produce substantial cost savings soon after implementation and even larger savings over time. And we believe the IP 44 fiscal note should inform the voters about this potential. And that concludes my comments. Thank you.
Excellent. Thank you, Andrew. Any others that wish to testify on IP 44? And our last one, Initiative Petition 57, is still undergoing review for signature count beyond our normal deadline with an order out of Judge McShane, and obviously still some legal challenges. But anyone that would like to testify on Initiative Petition 57's statement? Excellent. Well, did we miss anyone else inspired to testify on any of the initiative and statements for both the FEC and the ESC committees? This might be the shortest public hearing on record, and want to thank you all for joining today and offering your testimony, as well as submitting written comments for those of you that have today. We'll accept written comments through the close of this hearing and up through 11 a.m. this morning. We will post all of those written comments on both the FEC and ESC pages. Share those with the committee members who will have their reconsideration meetings next week. Their deadlines is an August 5th Wednesday date to file those final statements. And we will also post a link to this public meeting and the recording on both of the websites as well. Again, a big thank you for all of your public comments and testimony, and that concludes our public hearing for the FEC and ESC statements. Thanks so much, everyone.